Hello, my name is Julie Hebert, and I'm here to go over the benefits for the Liberty Dayton Regional Medical Center for the year beginning August 1st, 2026. You should all be receiving this handout in your email and have access to it, but I just wanted to go over some of the information since we are making a big change in the medical insurance this year. Um, Please see my information here. That's my name, email address, phone number. My partner is my husband, Stephen Hebert. A lot of you know him from the New York Life insurance that he's also works with you guys on. So there's his contact information as well. So this year, the group is moving to Blue Cross Blue Shield of Texas. So that's going to be a pretty big change for everyone. And you have a unique opportunity this year to sign up for some low cost coverage. And we're going to go over that. And so here's the 800 number, the website, and then the dental, vision, life insurance will all stay with Principal. So there's information on those things if you need it. Here's some helpful information about just insurance. There's a lot of terminology out there about health insurance, and these are things, if you get confused about what means what, you can come back to this and look it up. Open enrollment is going on right now. It's important that you try to get everything completed as quickly as possible since we are moving over to Blue Cross Blue Shield. We're going to try and get this done quickly and get the information over so we don't have any issues in your coverage beginning August 1st. If something happens after this time period of open enrollment and you need to make a change, then you need to let us know within 30 days. The reasons that are eligible for you to make a change in your coverage, if you say, you know what, right now I'm on my husband's plan and I don't need the health insurance. If something happens and he loses his job and you need to be added to the coverage, you have 30 days to let us know. So things like birth of a child, loss of coverage from either an employer or a parent, adoption, marriage, death, or divorce. So if you had some kind of big life event in your life that impacted your health insurance coverage, that gives you a reason to make a change for you or a dependent. So this talks about who's eligible, basically all active full-time employees, their spouses, and dependents up to age 26. And you are eligible the first of the month following 60 days of active employment. So definitely work with Jordan if you have any questions about your eligibility and when your coverage would start, or you can reach out to me. So this again talks about some of those life events. This mentions Ease HR, which is the system that we use to do your enrollment. You'll start receiving emails and you'll receive these emails until you complete your enrollment and then they will stop. So if you want the emails to stop, please go ahead and complete your enrollment as soon as possible. So medical insurance. So this is a big change this year. So let's spend a few minutes on this. One thing that the hospital board really wanted to try and do is offer a plan to employees that makes it affordable enough that maybe some more people will sign up. We currently don't have a large participation in the plan, and we're really trying to encourage people to consider having health insurance, and the Liberty Dayton Regional Medical Center is going to contribute $1,040 per month. Last year it was $775. So this is a really significant increase. You guys did have some major increases in the cost of your coverage, and the hospital board is stepping up and really trying to help make it affordable for you to still have health insurance. So there's three different kinds of plans out there that are available for you. There's the HMO plan, which does require you to pick a primary care physician. That primary care physician is going to kind of direct you through the system and make sure that you stay in network. It is a little bit smaller network. It's the Blue Essentials HMO network, which is still a very strong network in the Houston Golden Triangle area. So you can still find a lot of providers there. Then there's also the high deductible health plan. So a high deductible health plan does have lower monthly premiums, but it does require you to pay more of your upfront out-of-pocket cost for coverage until you reach your deductible. One great thing is that the hospital is making this where it's only $25 a check for you, and they are also contributing $50 a month to your HSA account, which would help offset some of these out-of-pocket costs. We'll go through that in a little bit more detail in just a second. So the PPO plan is kind of the gold standard in PPOs. You have access to the Blue Choice Network. You're not required to pick a primary care physician. You can go to just about any provider, anywhere in Houston, Greater Metro, Houston area, Beaumont, Baytown. It's a very, very wide network with Blue Cross Blue Shield and their Blue Choice. A doctor almost just doesn't take insurance if they don't take Blue Choice. So here's some information on how to find a provider. It's very important since we have three different plans and we have different networks that you consult which network you're using. So if you're on the high deductible health plan, you're in the Blue Premier network. If you're in the HMO, you're in the Blue Essentials. And if you're in the PPO, you're in the Blue Choice. So that's super important that you know which plan when you go on to Blue Cross Blue Shield and you try to find a provider that you're searching the right network because there is a pretty big difference there. One thing to note that's very important with Blue Cross Blue Shield is that you do receive lower pharmacy costs when you use a preferred pharmacy. Walgreens, HEB, Walmart, and Access Health, which is a smaller network of pharmacies, which does include like Rogers and Berkshire Brothers pharmacies, those are all preferred. So you're going to receive a lower out-of-pocket cost. CVS is not a preferred provider for Blue Cross. You can go there, but your prescriptions are going to be more expensive with Blue Cross at CVS. So that's really important and something different from United Healthcare. Here's some information on MD Live, which is a telehealth benefit that's available to you. It is a lower cost option if you have a cold or need to talk to a doctor if you're out of town. This is a great option for you. Here's information about urgent care. Just be sure that when you're looking at an urgent care that you have one and know where one is close to you. Of course, you have the hospital available to you, so that's a little bit of a unique situation. But we encourage folks to stay out of the emergency room whenever possible, just because those copays are very, very expensive. Excuse me. So the high deductible health plan is the first plan right here. So you can see it is in the Blue Premier Access. You do not have to have a primary care physician. It does have a $5,000 benefit deductible. So the important thing to know about this plan is that everything you do, you're going to give them your Blue Cross Blue Shield card. You're going to say, I have this coverage. They're going to run the Blue Cross Blue Shield coverage and they're going to find out, let's just say you go to your primary care doctor. Instead of having a set copay, you're going to pay the agreed upon amount with Blue Cross Blue Shield. And the same for pharmacy, for lab work, everything you do, you're going to pay at a reduced rate from Blue Cross Blue Shield's agreement with that carrier and that provider, but it's not a set copay plan. And you can use that $50 a month that's in the HSA account to pay for any of those expenses like copays, prescriptions, lab work, any of that that's out of pocket. Once you've spent $5,000, everything's covered at 100%. So on this plan, if you have a heart attack and end up in the hospital for 2 weeks, the most you would have to pay out of pocket is $5,000 for yourself, or $10,000 if you cover more than just yourself. You can see there the hospital district is really helping you with the premium. It's only $25 a paycheck. The middle plan is an HMO plan, so it is in the Blue Essentials Network, which is a broad network for Blue Cross Blue Shield. After you've met your deductible of $7,250, the coinsurance is zero, so you have no coinsurance. So the only way to get from the $7,250 to the $8,150 max out of pocket is through some copays that you might pay. If you go to the doctor here, it's going to be $45 to go to your primary care doctor. A specialist visit is going to be $90. Urgent care is going to be $75. Everything else, pretty much except for the ER, is going to be subject to that deductible. So you're going to pay that agreed upon amount also with this until you reach that $7,250. Then you have, I do have a prescription plan on this. So it's 0 for generic, 10 for preferred drugs, 50 for retail, and then you get into the specialty medications. So there is some information there on that. If you say, you know what, I want to be able to go to whatever doctor I want, I don't want to have a primary care, I don't want to have a referral process, then the PPO plan is the best option for you, especially if you have a really specific doctor that you want to make sure you can go to. This plan does have a $3,000 deductible per individual, $9,000 for the family coverage, and then it pays at 70% until you've reached the max out of pocket of $9,000. It does have a copay of $55 to go to your primary care doctor and $110 to go to a specialist. Urgent care is $75. And here you're subject to that 30% coinsurance. So once you've met the $3,000 deductible, you're paying at 30% until you've reached that maximum out of pocket. It does have a hefty ER copay of $750. Remember, if you are admitted to the hospital for the reason that you go in, that is waived. They are really trying to steer you away from a higher cost emergency room visits. The prescription copay plan is the same as the HMO. So these are the semi-monthly premiums. It is, still not free, but they are trying to really make this plan more attractive for you guys. This talks about the HSA account, and basically the hospital is going to contribute $600 a year. You can contribute an additional amount, so you can go up to $4,400 for yourself or $8,750 for your family. So that kind of helps keep those costs manageable. It is tax-free. If you don't spend all the money, it's your money. You can take it with you if you leave the hospital. And then also you can use it down the road in retirement. If you say, you know what, I'm healthy, I've never even spent this money, you can use that money down the road in retirement. The dental insurance is going to continue with Principal. We were with them last year. And so you're going to continue that. You can basically go and get your teeth cleaned twice a year, no cost to you. That's going to be covered at 100%. So you get 2 cleanings, you get basic x-rays, you can get fluoride treatments for kids. All that's free. So if you're on the dental plan, please, I encourage you to take advantage of those preventative services that are completely covered. If while you're there, they say, oh, Julie, looks like you have a little cavity. A cavity is going to be covered at 80%. You would have a $50 deductible. Then they're going to cover that cavity at 80%. You would pay 20%. If it's something like a crown, a major service, then it would be a 50-50 arrangement after that $50 deductible for the year. And then you do receive $1,500 a year in dental benefits. There are the semi-monthly payroll deductions for that. Remember, you can cover yourself for medical only and then pick up a spouse or children or everyone for the dental and vision. Those all work independently. You can select that as you go through ease. The vision insurance utilizes Principal, but it utilizes the VSP Choice Network. You can go and get your eyes checked every year for $10. You can get a contact lens. You get $130 towards that, $130 towards frames. You get new lenses every year and new frames also every year if you want to, but they're going to give you $130 towards the frames, and then I believe 20% off of anything over that. So you have a $10 copay basically for your lenses, and then it should be covered. And this is the price. I do encourage you to utilize the VSP network and try to make sure that you're staying in network. You're going to receive a much better benefit. You can see the in network and out of network coverage here. So much better benefit if you can stay in the VSP network. The hospital does provide a $50,000 life insurance policy. So even if you're not signing up for anything else, we need to make sure that we have that information on file and we have a current beneficiary for you. If you're over the age of 65, it does reduce by 35% and then another 50% at age 70. Voluntary insurance, you can purchase a different additional coverage. If you didn't buy it last year, or if you're not new to the group, you would have to answer medical questions if you haven't purchased it before, or if you want to increase your amount. That is easiest really to look at in ease because it's all based on your age. So that coverage would come up as you go through. You can also purchase for your spouse and for your children. This talks about how expensive the plans would be if you leave the hospital. So this is a good opportunity for you to see how much subsidy the hospital is providing by paying that $1,040 a month. So the plans are very expensive, and so their coverage is definitely helping. This talks about what happens when you turn 65 and how Medicare works with the coverage. Here's a handout on Blue Access for members. This is talking about the mobile app or going on your computer and setting up your My Blue Cross Access. This is very important since this is new for you guys. It will help you get a digital ID card. It'll help you find providers. You can locate hospitals. They have a cost of care tool. So you can find the lowest cost place to have like lab work done, x-rays, imaging. There is a very big difference in the cost of those facilities. So if you are paying part of that out of your pocket, it's worth your time to spend a little time and learn the website, figure out how to find the lowest cost options. This also has health information. It has pharmacy information. It has a ton of information out there. It will show you what all your preventative care, which I didn't mention that earlier, but all three plans do have 100% coverage of preventative care. So you can get your well visit, your physical, you can get flu shots. All those preventative services are covered at 100% on all three of the plans. This talks about setting up your principal account. You can also get an app for that. Helps you get a dental ID card. You can look for dentist and vision providers in the network, and it's a lot of great information. So we appreciate you guys so much. We hope you'll take time to come by and visit with us, and we can answer questions. We will be here middle of the week, July the 6th. So the 7th, 8th, and 9th, we'll be in the conference room. And if that doesn't work with your schedule, my phone number is listed there. You can always reach out to me that way or via email. So we appreciate you guys and hope you have a great day. Thanks.